time off. I appreciate everybody's patience as we move through these things. Today, I wanted to give an update on the supportive housing benefit with members of the work group that have been teasing through this benefit and how it would flow with, particularly with the community mental health centers for many, many months. And the first thing I wanted to start with is some homework that you folks gave us from our prior session about this when you asked about how will this 1915I benefit intersect with a person who is on Medicaid with a spend down. So we connected with our policy team and they confirmed the benefit will still be available to them. It will operate still like much anything else does in terms of their access to Medicaid services. They have to meet the spend down first. Whatever day of the month they meet the spend down, then they'll be open for Medicaid. They could have those services. So for the community mental health centers, I think it might have been Patricia who shared in a prior meeting that you folks generally will try to get someone into a case management session early in the month. So that tends to be a higher expense item, and so it can help trigger their Medicaid eligibility sooner in the month. Is that a decent example for us to think about in this respect? Suzanne, I'm not sure. I thought you raised your hand for a second, but maybe you didn't.
No, sorry. That
Okay.
was the next one, yeah.
All right. So yes, that's what you'd need to do again, is you'd want to make sure that you're trying to get them opened up for Medicaid before you provide the benefit. Ideally, if not, it's going to be a benefit that will help them make their spend down. So I'll just pause there to see if there are any questions. Okay. So moving on, we've been working on the documents for the supportive housing package, and we want to take you through them, I believe, starting with the application. Jeff, is that correct? Yeah, we're just going to start with the application. So I don't know who's going to present, but I will turn it over to the members of the team.
I can go ahead and share my screen. So yeah, we're going to review the application, the notice of decision, and the prior authorization form that we've put together for the benefit. So this is the application for eligibility for services under 1959. This is what would be done by the RAP following the coordinated entry assessment to determine that has shown that they're likely eligible for this benefit. So you would include the applicant's name and identifying information, social security number or Medicaid ID. Just either one of those will help us look up the member in New Heights and MMIS. The HMIS identifier will help with BHS on their end, Bureau of Homeless Services. The information that needs to accompany this application is the coordinated entry assessment, which Bureau of Homeless Services will have access to through HMIS. The housing status documentation to verify current chronic homelessness, history of chronic homelessness, or risk of chronic homelessness, and in addition, the disability verifications. The RAP would include, and I know this doesn't apply to all the CMHCs, but I know at least one of the CMHCs is also a RAP. You'd include the housing navigator, the person who is working with that particular client on gathering all this documentation, include their contact information. If there is an identified pre-existing targeted case manager, whether that's at the CMHC or within some other domain, we'd include, the RAP would include their information, and the RAP might not have that information right away. So that is that's why the Medicaid ID will help us on our end when we take a look back at we'll do a service review. to see if someone has been receiving targeted case management, or at least to verify that that this information is accurate. Let's see, and you have the housing status documentation, disability information. They should be uploaded into HMIS. If they're not uploaded, they could be attached by email, and we will include instructions on encrypted email and those procedures. We'll include that in the trainings to the reps as we move forward. So pretty straightforward application for services, and we at this point we really just need the verifications so we can take a look in the system. Are there any questions about the application at this point?
No.
We can move forward to the notice of decision.
Yes,
So then, I'm sorry, go ahead.
I said yes, but
Okay.
I don't know if somebody else was saying something at the same time.
So the notice of decision, this will be going through New Heights. That at some point we are in the queue to be added. So for now, in the meantime, at least until I think the earliest, the first of the year, first of next year, we'll be generating this document manually. But we did model this document based on what will be generated by New Heights. So just your basic eligible or not eligible. That's just stating the action based on what we received. If someone is ineligible, we would give the reason why. We'd state if there's documentation we didn't receive, we'd state clearly what we needed that we didn't receive. Or if someone's benefits aren't currently open, that could be another reason for a denial. We will include there's updated language that's going to be added to the New Heights generated notices about the rights to administrative appeal. And this is these are the instructions. The actual procedures haven't changed as far as I can tell, but the language did change slightly just to make things more clear.
Yeah, it's in my setting.
Yeah.
Jeff- Jeff, I have a quick question. And Vic,
Sure.
your mic is on. Jeff, I have a question under that part right there under number 4. It says to appeal a decision about your SNAP benefits. So is the SNAP reference here an artifact from an original, or does that have to be on all notices of decision, even if the program has nothing to do with SNAP?
I am going to double check on that. I don't think it's necessary for this. I think when it's generated via New Heights, usually they're including information about multiple programs when they send this out. So I'm going to double check with the Medicaid policy folks and see if it's okay for us to update that.
Okay. And then the other thing is that incorporating this into New Heights, it's actually the earliest date is 7/1/25. Because it's
7/1
not.
now? Okay.
Yeah, because it's not going in this budget cycle. It'll be
Okay.
the next budget cycle.
Okay. Yeah.
So
I think the original
we'll
conversation was the
Yeah.
earliest that their IT people could do it, but yeah, that
Right,
didn't take into account the
right.
budget cycle. Okay.
Yeah, it's an add-on charge under the contract with that vendor.
Okay. That makes sense.
Sorry.
Before we move on, can I ask a question? It's Jay Kuchar from Seacoast. For the spend down people, if one of the reasons for not eligible is they're out, they haven't met their spend down for the month, does that mean you can't apply until someone has met their spend down? And if it's a monthly spend down, how does that impact eligibility?
I don't
Well,
think that I'm sorry, go
Yeah,
ahead,
go.
Jeff.
They wouldn't need to apply every month. This would just establish the eligibility within New Heights. So this They
Right,
wouldn't,
but if they haven't met their spend down, will they be denied because they don't have Medicaid? Or does New Heights show them as having Medicaid but not having met their spend down?
exactly, it would show that they have Medicaid and would be eligible for the program,
Okay.
but would not be eligible to be, wouldn't be able to be reimbursed for services until the spend down's met.
Thank you.
And I do remember part of the conversation there was the concern about multiple agencies working with this benefit and serving the same client. So I think it was you, Jay, maybe not, that described that had an example of you're providing the services, someone else is actually doing the case management. Do they know that they should be submitting documentation for the spend down so that the CMHC isn't the one who's not being reimbursed for services at the beginning of the month and then also needs to submit the spend down? I think that's something that we will need to work out with those providers along the way. Some of these providers that may be providing the supportive housing benefits haven't been working with Medicaid in the past. There's going to be TA along the way, and certainly the discussion of how to manage someone with a spend down is going to be part of that conversation.
Okay, wasn't my question, but it's a good one.
Jay, I'm guessing that the centers will appreciate when we develop the guidance to have like a specific section in there talking about individuals with spend downs.
Right. Historically, it's just the
Yeah.
hospitals and the mental health centers that absorb this. So if there are other providers involved that you think are then going to absorb that loss, I would be interested to see how that's going to play out. Yep. That'd be great.
So yeah, just moving to the last part of the notice of decision. Yet again, we'd state clearly what documentation, what evidence was missing, and what we would need to reconsider the application. And then a reference to whatever policy or rules we were referencing in making the determination. So for now, that is the 1959 approval package. We are developing a provider manual. We've been going through the drafts on that. It should be ready soon. At that point, we will include the provider manual as the reference. But for now, it's the 1959 approval package. And yeah, we streamlined this a little bit. What is generated by New Heights often has other information about additional programs. We don't need to be managing that at this point. After next fiscal year, when this moves into New Heights, the document will look a little different. But I think we've streamlined it to what we need. And I will take a look at the language here to see if we still need to reference SNAP benefits. We likely don't, but I want to confirm that.
Question.
Yes.
Hi, it's Kelly Cap. The notice of decision typically like here is addressed to the recipient. Who are you going to address these to and where are they going to go?
That's a good question. So whatever address we have on file that's been provided to us for that client by the rep. So not all of these clients are going to be homeless. Some of I anticipate that some providers will be seeking approval to provide the sustaining services for someone at risk of homelessness who's already housed. So in that case, we send it to the client's address. Otherwise, we send it to the address that's been provided to us by the rep, which is hopefully as up to date as can be. I know that's tricky.
And Jeff,
we will also be. Oh, go ahead.
I was going to say, we can help support the providers in that as well, because a lot of times we could use the emergency shelter address, or a lot of the drop-in centers are now allowing people to get mail there as well. So we could work with the RAPs to create a plan for where mail can go in the event that somebody's not at a shelter and has a mailing address there.
Will the authorization be in MMIS?
Yes.
Thank you.
We will also, at this point, we'll be communicating directly with the reps too. So they
Can
will
I-
know whether or not someone's been found eligible or not.
Jeff, if I can back up to Kelly's last question for a second. Kelly, when you mean will the authorization be in MMIS, do you mean will you folks be able to see that they're open for supportive housing in MMIS, or are you talking about the service authorization itself for each?
I literally
service?
mean the service. Well, I mean, one will get me to the other, but I literally mean the service authorization. So in other programs, I can go into MMIS and see the service authorizations. I get a daily list of auths. I get a weekly summary of auths in one big spreadsheet. It's just the functionality of the MMIS. But if I can at least go in and see who's authorized, because sending them to a recipient isn't going to be a communication to the provider, and it could delay access to services.
So we might be having a language issue. This benefit, every service they get has to be pre-authorized. So we have to issue a service authorization with the actual provider who's going to provide the actual service. You know, the period of time, estimated units, all of that stuff.
Which
So
we'll
that's
see in
the-
MMIS, right?
Yes, that's what I'm talking about for authorization. If you're talking about authorization, like being able to see if somebody is open for a particular program, and I don't work in MMIS, so that's why I'm just trying to clarify my understanding.
Yeah, I was asking about if I would see the MMIS service off.
Okay.
While I
I think
really
you-
won't be getting a notice of decision.
No, I think you should see the service authorization is going to happen after the notice of decision.
Jeff, you trailed
will-
off a little bit there.
Well, I'm not sure I understood Kelly's last question. The service authorization, we can move on to that form, but that's after the person has received the notice of decision. It's at that point that the providers who've been identified would be submitting their service authorizations.
I'm with
That
you,
would
so
go-
I still need to know before I submit my authorization that you've approved them for the program.
Okay.
Right, and I think in our, in thinking through some of the workflow process, the originating the originated regional access point would be notifying like an existing targeted case management provider that the person was eligible for this, and we can certainly have the ability of this decision be part of that notification, if that's what would be helpful.
That would be helpful.
Okay, it might already be in our workflow, but our workflow is still being revised as we're surfacing lots of different nuances.
Thank you.
So yeah, part of the process is whichever regional access point has been working with the client. It's that housing navigator will be in communication with them if someone is open, has been, well, not open, has met eligibility. And it's at that point that rep has the responsibility for coordinating the services, communicating with the targeted case manager, or if that rep will be serving as the targeted case management organization, that it's at that point that they would be submitting their authorizations and identifying the agencies that are going to be providing the sustaining and transition services. Does that make sense?
Yes, sorry about that.
Okay. Let's take a look at the authorization form. So, Lorian, do you want to review this? I know you've worked on this almost.
Sure. Thanks, Jeff.
Sure.
So this should look very similar to other fee-for-service authorizations. We did add a few different things up at the top. There are indicator buttons for whether this is a new authorization or a reauthorization. So you can just click whichever is appropriate. We pre-populated all the procedure codes, and the last two we're still verifying. That's why those are highlighted. But those are the codes we expect to use. So we pre-populated it to make it easier for you, and you'll need a different form for every provider because there may be multiple providers involved in these services. Let's see if you, scroll down just a little bit more, Jeff. There's a spot for the provider to sign off, and then it shows at the bottom, we need this sent by encrypted email, and there's an email address there. Because this contains personal information, so it's got to be encrypted, not regular email. Does anyone have any questions? After this is entered into MMIS, we'll get an authorization number that will go back to the provider, so they'll be aware that it's all been processed and what number to put on the billing. If you want to add
So-
anything, Jeff, go ahead.
Did folks, by us pre-populating, we're just trying to make the form quicker to use, but an individual doesn't have to get all of these services. And if the individual is going to get targeted case management to continue where they currently have targeted case management. So for instance, community mental health centers, there's already targeted case management, obviously that's provided. You wouldn't seek a prior auth for targeted case management T1017 because you're already providing case management under T1016. So it's just there for those cases with other providers where somebody needs a case management as a service that they're not already getting, and they could have access to it under the supportive housing benefit. That's when we would use T1017. So we just wanted to make sure that you folks wouldn't think it was more confusing that we pre-populated the options. So I just wanted to throw that question out.
Well, it's not more confusing to me. I find it helpful.
Okay,
I
thank
do have
you.
a question. I'm sorry, Nikki, just based on what Maureen said, when she said the forms need to be submitted for each provider because there could be different providers of service. I just want to be clear that you mean by each provider, right? Each provider submitting their own?
That's right.
Or is the wrap, because we're the wrap, I want to make sure we're not sending all of them for any provider.
No.
Okay, thank you.
Yeah, each provider needs to submit their own authorization.
Nikki?
So for the folks that are providing the targeted case management, they wouldn't provide the service authorization because they're already providing targeted case management. But can you expand on what the service authorization would look like if they decided they wanted to also provide transition and sustaining services?
Sure. So if one of the CMHCs has a client and they are eligible for this benefit, they would be picking those one or both, depending on what the care plan comes up with, of the supported housing transition, supported housing sustaining, because their targeted case management is being provided under a different benefit, not under this benefit. So that's why they don't have to fill it out here. And then the housing consultation plan of care code T2024, that same community mental health center isn't going to need to do that because they don't have to come up with a separate plan of care. There's already a plan of care and there's already a housing domain. So they would build into that housing domain on the existing care plan essentially what the person needs for supportive housing. So I suspect most of the community mental health centers are only going to be submitting for the H2021s, unless, like Manchester, Patricia shared the example of some people that are working with their PATH programs that haven't really wanted full CMH services, and this might be a way to get them to engage. So if that, in that case, if somebody that they were working with said, well, yes, I'd like case management just for this, in theory, that community mental health center would do the targeted case management T1017. But then in that instance, Manchester cannot also be the one providing the supportive housing, because the targeted case management available under supportive housing has to be a different provider than the one that's providing the supported housing services.
So Diana, can I have a follow-up question for that?
Yeah.
I don't know if you can hear me. Okay. It's
I can,
Jonathan.
Jonathan. Yes.
Okay.
Thank you.
So as the mental health center, if we're providing the T1016 targeted case management, our case management plan could authorize the housing benefits here without somebody needing a separate housing services TCM provider.
Correct.
Okay.
They can't have two TCMs anyway, so that would,
Right.
that's correct.
Okay. Thanks.
Nikki?
And for the folks that are offering targeted case management, if they are deciding that other folks within their organization would be providing transition and sustaining services, when would the service authorization be submitted? Would it
The
be when the
beginning-
RAP?
Sorry, go ahead, Nikki.
Would it be when the RAP reaches out to say, hey, we noticed you have targeted case management, do you want to do these services? Would that be an ideal time for the agency to provide the service authorization for those transition and sustaining services, knowing another person in their organization will be offering them?
I think that they need to confirm that they need to add, they have to develop the plan, the supportive housing plan within their existing case plan. And that process would then trigger the identification of who's going to provide the supportive housing services. Then they would want to do the service authorization request. So I think we're saying the same thing. I'm just putting a little bit more detail into it. Patrick? Oh, sorry, it's Jim. I thought it was Patrick. It's a little tiny little face right there. Sorry, go ahead.
Yeah, no worries, Diana. So if a client is approved for services utilizing this process, is the approval retroactive? Or is it from the point of, once it's approved, that moving forward?
I'm trying to understand, Jim, how it would be, there would be a retroactive implication for it, because the center would need to be notified they're open for it. Why would there be a retroactive piece?
Maybe that they
Well,
were
you-
providing services that fell into this category before, applying. I would just, because sometimes, when clients apply for Medicaid is retroactive, right?
Right.
And can be, and I was just curious if this would be retroactive as well. If you've considered that, or if not, that's fine. It's just a question.
I don't think we've considered it. We should take it back, Jeff. I mean, they have to be open for Medicaid to be able to apply for it, but we didn't say that they couldn't apply for it at the same time that they were applying for Medicaid. Indeed, some people might be doing it that way.
So I just want to ask a clarifying question. So is the situation that someone is like a housing specialist at the CMHCs are doing work that falls under these categories that isn't being compensated by some other means?
Yes.
And then, okay.
But I think
Yeah,
the
well-
other piece of that example is that we submit the program authorization and you approve it. And in between that time and the time this form comes up to you, like, would somebody be able to start rendering services as soon as we knew that you approved them for the program? And the authorization still has to come up to you and be approved.
Yeah. We'll take it back and think about those. Those are good questions.
What do you
And-
expect the turnaround time on the authorization approval to be?
It should be pretty quick. Right now, we're at this point, we're not expecting huge numbers. We're doing this process fairly manually internally. So I think especially early on, the turnaround should be pretty quick.
And those
Good.
service authorizations getting into MMIS would be in real time? Because right now there is a breakdown with that. Sometimes, like we have the issue with FSS waivers. We get the FSS waiver approval, but then it can be months before the authorization gets entered into MMIS so that we can bill and get paid for the services.
The way we have this currently set up for this benefit, there shouldn't be lag time like that.
Okay, great.
The workflow for that is, the RAP is communicating with Bureau of Homeless Services. Bureau of Homeless Services is communicating that to myself and Lori, and right now we're the ones doing the service. So I don't think that there should be any significant lag time there.
And
I mean,
Melissa, for housing services, you've got 2 staff, you've got 1 primary and a secondary to help in terms of getting the documentation flowing from the RAP to policy team, right? And then
Right.
we'll have at least 2 backups in the policy unit for the service authorizations.
And Diana, I'll add that we have Christy and I as backup as well. So we have the primary staff, the backup staff, and then 2 people in our leadership team who will be monitoring that inbox as well. That way, if there is any sort of delay, we will be able to catch that quickly.
Kelly?
we will certainly work within whatever the framework is and just need to be clear about it. But I know that like our housing folks, and I think Melissa, this will probably be familiar to you, but my housing person said to me yesterday that they were told it could be a week. And that's fine, except for in that, like, they need the support today, right? So people really need us to do this today. And even if it's just a week before the authorization, there's that question that you're gonna take away and consider if that window is between the time of the program authorization and the service authorization, which is one thing, and whether we absorb it because it's only a week or a day, just need to know whether we're billing or not, because we will render the service.
And
Yeah,
Kelly, I
no.
haven't heard that time frame of a week, so I'm not sure where that came from. I don't think we've established any sort of time frame internally yet. So we'll bring that we'll add that to our list again. You folks are very good at giving us new things to explore. So we'll add that to the list and we'll address that next time.
And I know Jay's got her hand raised, but as I'm sort of playing out the whole retroactive concept as well. I mean, if the person is open, the day that they would be open for Medicaid could actually be the first day that they would be able to also be eligible for this benefit, right? In theory, you could go all the way back and backdate it. I don't think that we necessarily have a problem with the starting date of service. Let's just say today's August 2nd. Maybe Diana was found eligible on July 20th, right? And by the time the targeted case manager finds out that Diana is eligible for this benefit and, hey, yes, we think she should get this benefit and we want to put in a PA, it might be August 2nd that the PA is filed. But if the starting date is that July 20th, that's okay. I mean, we get that in waivers right now already. So I just wanted to share that, you know, we should be able to tie the start dates to the eligibility period and when you want to start doing services. Jay?
So I was just gonna request that as you take your homework back, that pretty quick needs to be more specifically defined for a time
Right.
range for expectation.
Right.
No.
Please.
That
No.
makes total sense that we would need to do that as well.
Now, what I don't think could happen is the supportive housing services would need to be in the plan of care. Like billing couldn't be backdated beyond the establishment of the service within the plan of care.
Understood.
But I understand that there could be a little bit of lag time in getting those services organized and getting service authorization put in for those additional services. So I could see, I could see those services being rendered in the meantime, for sure. We'll take that back.
Nikki, did you want to address your comment for the group?
Sure, I just put a note in the comments, just kind of putting out something I think we're all familiar with, is if the supporting documentation that's required for eligibility isn't complete or is insufficient for the purposes of this program, that would create delays. So just pointing that out.
All right. Jeff, is this the last form for us to go over?
Yes, it was.
Okay. Do you folks want to walk through them again a little bit more slowly? Have us bring it up to screen, come up with any other questions we have? Okay.
What is the start date of this program, Diana?
Well, we had targeted July 1st, and of course we ran into a few little challenges. So we don't have an approval yet from CMS on using that new code in the rate. It was submitted, I think, about 3-4 weeks ago now. But the person who would be reviewing it had gone on vacation also, so we should be hearing from them soon, I would hope. And we currently don't have any provider, right? I don't think we have any provider, Lorian, that has finished the enrollment process completely.
That's right.
We
I
thought
just
we
queried
thought
it
we
this morning.
did.
We've
Yeah.
submitted ours, but it's pending with the state.
Okay.
Yeah, there
Allie, do you
are
know?
a dozen or so that are in various stages of pending.
Okay.
Yeah.
Allie, has it been pending for a while?
I believe so, because I think we had submitted it at least 3 weeks ago or more. I know, I think the last meeting that I was in attendance, I had said that we had submitted it. So it's been pending since then. So at least 2 or 3 weeks, because we haven't met.
Okay. Lorian, do you think you can connect up with the conduit folks or provider enrollment to see? Let's just use the Riverbend one. Allie, you're Riverbend, right?
Manchester.
Manchester, sorry. You think I'd have
Okay.
it straight by now after all these years? To see how it's going with Manchester. I just want to make sure nothing's falling through the cracks with either conduit or provider enrollment.
Okay, yeah, for
Thanks.
Manchester, I see the status says in process. But I can
Right.
try to connect with them and see, because there are some others who say incomplete. So possibly they need more information. Yeah, I can connect with them and see what we can do.
Great, thank you. Okay, anything else on supportive housing? Okay. For the CMHC EDs that are here, the directed payment presentation that I made a couple of weeks to you folks, I went on vacation and I'm just hoping one of you could tell me, did we send that out to you already, or do I still need to send that out to you? I know I
Yeah.
gave it to you in print, but I thought I was going to
Yeah.
send it to you also.
Yeah, you sent it.
You
I
sent
did
it.
send it? Okay, great,
Yeah.
thank you. Just want to make sure I didn't owe you that still. Okay, so for next week's meeting, Carolyn Richards, the state's, the department's waiver administrator, is going to be presenting on the community reentry program. CMS recently approved the department's amendment to our existing SUD, SMI, IMD demonstration. And in approving the latest amendment, they extended us for several years, and they approved the new community reentry benefit, which has a target start date of January 1, 2025. So she will present for you folks. I know I've done a little bit of presentation on this topic, but I thought it would be good if you could hear from her. And in particular, if you have some more specific questions than I could answer. And then after that, we will present to this group on the 2025 directed payments because we are looking at one new payment being added and a couple changes to others. So we'll present and get more into the weeds on that topic for next week. Does anybody have anything they'd like to surface for today? We have another 17 minutes, or we can drop early if folks would prefer.
Diana, is there any timeline on the changes that were being done to HEM 426? There was, some addition of some new service codes, and I think we had talked about unbundling FSS, changing limits, that kind of thing. Is that still on target for 9/1 or?
So Eve will speak to the rule changes, the IROS changes to unbundle. We have submitted the CSR for that. I don't know how long it's going to take. Maureen, do we have an idea of how long it will take for MMIS to make those changes?
I know they're working on it. We've got the target date of 8/31.
Okay, great. So the unbundling piece should be able to be done in time for 9/1, and we would issue guidance that basically explains that you no longer have to do the waiver for those under the rule. Eve, that's something that we can work on if the rule is going to take longer, and I think that timeline is different, so I'll turn it over for you on the rule.
Good morning. Yes, so the rule work, we had a change in staff within our legal services. So we focused our efforts on HEM 401 earlier this year. That rule is nearly settled with our attorneys. And then we're going to go back to the draft of 426 with all the changes that have been recommended. Our attorney will be going through that rule to review all the edits, look at them against the rulemaking requirements from the Office of Legislative Services, and also connecting back with Diana's team to make sure that any state plan amendment pieces that have been moving since that rule was last reviewed with her team are accurate and reflected in that rule before we move forward. So we anticipate we're not likely going to have a version of that rule to move forward prior to the end of this calendar year. And then the rulemaking process will take 6 months to go through the department's rules unit and then the official rulemaking process with the Office of Legislative Services. So we will not have a version of that rule in effect within the next 30 days. However, we are aware that there were a number of changes within the Medicaid changes that will need to have some communication out to the CMHCs. So our attorney has advised they will meet with Diana's team and our bureau and help craft guidance for our CMHCs to help give any messaging needed around anything that would be deviating from the current 426 to make sure that it is clear and that you have a document you can refer back to for any deviations. So an example of like a prior memo, just to kind of put it in context, is we have one that's still in effect regarding, I think it was the ISPs, individual service plans, and the allowance of using the ARNPs. So we issued a memo at one point saying that we were identifying that this was not entirely in alignment with the rule, but this was what the expectation was for providers until further notice and the rule could be updated. So it'll be memos like that one that was issued, I think, about a year ago at this point.
That's what I mean when I refer to guidance is, and that was a good example, Eve, and so was when we shifted the ISP having to be updated at least every 90 days to every 6 months. We did that through a memo, a guidance memo, to provide the directions to the CMHCs without formally changing the rule yet. So, anything else? Any other
Are we
questions?
expecting any rate changes as of 9/1?
Not on fee for service basis. No, I don't believe so. I think that you folks for your per member per month rate, obviously that would be for 9/1.
I know there was talk about the Cypress Center rate changing.
Oh, sorry, I'm thinking of all 10 CMHC. So Cypress Center, I don't know that will be ready for 9/1.
Yeah, Diana, maybe you're
Yes.
going to cover this next time, but what is the actual technical discontinuation date for the IMR service metric part of the direct payments? What is the actual cutoff date?
So when we would stop having a directed payment would be effective August 31st on the IMR.
Okay, all right, thank you.
Yes, August 31st, because this current plan goes to August 31st. Yes.
Okay.
Sorry, I just wanted to make sure I refresh my memory on there. I
Thank
do
you.
know I was in a conversation with Kelly La Liberty earlier this week, and I do know that we still have quite a bit of room to go. So I'm under the utilization that's associated with the directed payments and for several different categories, IMR being the one that's the least utilized right now. So we will have some budget adjustments to do in there. The rate might become a lot more for those qualifying events if we overall have a smaller utilization. So I won't know until we get through the whole period, but there will be some last minute adjustments to reconcile. Anything else? Okay. Does anybody want to see the draft documents? Like, do you want to get a Word version of them in a draft form so you could offer any particular feedback, or are we good for now and we'll just make those adjustments? For time purposes, I think we should just try to make the adjustments or address what we have to do in guidance. But I do want to acknowledge that if somebody has some particular language they would really like to be able to look at, that we could share those if you need us to. Okay. All right. We've got our feedback. Thank you, everybody. I hope you have a wonderful weekend.
Thank you.
You too, Diana.
Thanks.
Bye.
Bye.
Take care all.
Thank you.
Thanks. Bye.